In this episode, I'm going to talk about stem cell therapy versus Viagra and which one is better. So stay tuned and find out how your own stem cell in your body can help with ED and how Viagra doesn't. So follow in this episode. This podcast is for you, the modern man. I'm Dr. Truong, your host. I'm an intimate health medical doctor and best-selling author of the book Erectile Dysfunction Fix. I'll do a deep dive into sexual health and performance and how it affects men of all ages and backgrounds. So let's get started, and be sure to visit my website at sexualhealthformenpodcast.com for more information and resources from the show. See you on the inside. Do you know that you have stem cell in your body that can heal you and repair you and also regenerate you, especially for ED? Well, stay tuned because I am going to talk about the differences between stem cell that you have in your body compared to Viagra and which one you should choose. Well, I'm probably going to be biased, but the stem cell you have in your body, you already have in your blood. They're called platelets. These little, small platelets that are floating around in your blood that heals you. For instance, if you have a cut in your hand, what happens when you have that cut? The blood oozes into the area, and then it starts to repair the wound, and then the wound closes, and then you have a scar. Well, the cells that are responsible for that in your body is called platelets. There's this little balloon that floats around in your blood as part of your red blood cell that comes from the bone marrow that comprises about 10% of your blood. And what it does is that it goes to the area, it creates a clot, and once it creates a clot, it releases growth factors that call in other cells to come to the area to help for repair. And it repairs the injured tissue, and then once it repairs it, it brings in more blood flow, so that way the tissue is rejuvenated and sometimes even regenerated. So this was demonstrated for paraplegic for their wounds about 30 years ago, and the dentist has been using it for implant in the jaw. So if we extrapolate that, and you can get the platelets from your blood by just doing like a little blood draw you would do for going to the lab and do blood draw. You draw it out in 60 cc or 120 cc. So 120 cc to about 4 ounces or a glass of wine at that time. And then you put it in the centrifuge, which then separate it into several layers, and then you extract out the platelet that is in the blood, and that get delivered to either the penis to restore blood flow, or to the shoulder joint to help with rotator cuff injury pain, or even to the knee for knee pain and even mild arthritis. In fact, the American Association of Orthopedic Society recommend using a platelet-rich plasma or PRP for mild arthritis pain as compared to steroid. So let's dive in today, because I'm excited to show you. So if you see this picture here, like I said, you collect the blood from the veins, and then it gets put into a centrifuge. And then after it spins for about 5 minutes, the doctor usually does this. You take it out, and then the blood looks like this. It's in the container, and the top part is called the platelet poor plasma. The middle layer is called the buffy layer, or where the platelets are, along with the white blood cells, and then the bottom is the red blood cells. So, and then the doctor would extract out the middle layer, which is the platelet, and that is then put into the injured area. The platelets has multiple growth factors that will stimulate repair, will stimulate more blood flow to the area, and rejuvenate the tissue. So let's compare platelet-rich plasma or PRP injection into the penis versus a Viagra or sildenafil. So those of you that can see my slide, you can see it clearly. And the one that are listening on the audio, follow along with me here. So sildenafil, which is Viagra, only treat the symptoms, like pain medication. Like you take pain medication for your back pain may go get better a few hours, but then the pain comes back. It doesn't treat the cause of the problem. And for ED, when you take Viagra, it doesn't treat the root cause of why you have ED. The reason why you have ED is because of poor blood flow that can be from multiple causes, like I had discussed earlier on my podcast. Now, compare that to PRP or inject into the penis. The PRP actually treat the cause of the ED, which is poor blood flow or leaky veins, because it goes in there and heals those leaky veins and rejuvenate more blood vessels, and is natural. The PRP is there's no side effects versus comparing the sildenafil or Viagra. You can have side effects such as headaches, facial flushing, the face getting red, stuffy nose, and indigestion, and even a blue tint vision. These are some of the reason why some of my patients come and see me, because they had bad side effects with Viagra. And then when you take Viagra, you can't be spontaneous. You gotta take it an hour ahead of time. You gotta plan it accordingly. Sometimes you take it, and then your partner falls asleep by the time you're ready, and then you're sitting there going, "Well, what am I supposed to do now with my erection, right?" And then sometimes when it doesn't work because is absorption of Viagra. It varies with what you eat. If you eat a high fatty meal, the absorption is actually less. And then comparing that to PRP is spontaneous. You don't have to wait. You can get an erection spontaneously whenever you want to. And Viagra, you also know that if you have heart condition or heart disease, or you have prostate problem, you can't take Viagra because it's contraindicated. It can lower your blood pressure very quickly, and you may pass out. Like low blood pressure, you may pass out. And then if you have high blood pressure, it actually will raise your blood pressure unknowingly as well. It could be dangerous as well too, and that can put you at risk for heart attack or even strokes. And the PRP is come from your body. There is no side effect. There's no medication to worry about. And one of the good things about the PRP is that it increases sensation also. So it gives you more sensation in your shaft and in your glands or the tip of the penis, and that the satisfaction with PRP is 85% compared to satisfaction with Viagra 70%. But one thing about Viagra you have to be really careful of is that it does wear off over time because the condition gets worse, or your ED gets worse, because you're ignoring the cause of the problem of why you have ED in the first place. I compare it Viagra to like pain medicine. It's a Band-Aid. It doesn't treat the cause of the problem. You end up in the black hole. And having ED is like having an infection that festers. Because all you're doing when you're taking Viagra, just putting the Band-Aid on the infection. You're not treating the cause of the infection. You're not treating the infection that's underneath the pus and the problem. And you're just putting the Band-Aid on and making it look better, and just trying to have some result that are temporary. But in the long run, trust me, you're going to end up in bigger problem than you want, because you're ignoring the cause of the why you have ED. And just briefly go over the 5 main things. It's high blood pressure. Five main conditions that causes ED is high blood pressure, high cholesterol, diabetes, smoking, not sleeping enough. You need to have at least 7 hours of sleep a day, and poor diet. If you eat a lot of processed food or fast food, that is really bad for your erection. And excessive alcohol, more than about 10 to 14 drinks a week. Now, those are just the major thing, but there are other causes as well too. So if you're having ED, I will advise you to start looking at those factors I just mentioned, see if you have it. The easiest way is to get your blood work tested by your doctor. And don't ignore ED, because ED, think of ED like an infection or pus that is there. If you ignore it, it's going to get worse. And one of the days, it's going to go deep, and you're not going to be able to reverse it. So treat it early. It's like treat it like your teeth. You get cleaning twice a year or every 6 months for your teeth. You brush your teeth every day. You floss every day. Why? Because you want to preserve your teeth until the day you die. Well, same thing. You can preserve your sexual vitality or your erection until the day you die, but you gotta nurture it. You gotta clean it. You gotta maintain it. And if you don't, you're going to be like losing your teeth. It's just going to get worse, and you're going to not be able to have an erection. So really look at what's going on in your body. First, you have ED. Get blood work first, and look at what you're eating, whether you're sleeping enough, your stress, as well as your exercise regimen. You need to exercise at least about 3 hours in a week, or even just mean that just going walking, enjoying nature. So thank you for being with me today. Make sure you put some comment down below, because I love to hear what your thoughts are. Would you do PRP, or would you do Viagra after you heard this episode? And let me know if you need to learn about some other topics and have me talk about it. I love to hear from you, and we'll see you in the next episode.
Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.